Our next task is bulimia nervosa. Bulimia nervosa. In this particular case, you are an FY2 in a GP surgery. You're an FY2 in a GP surgery. You're saying a 16-year-old was coming in with vomiting. Her mother has made an appointment to see the doctor, and you are the one who is calling the patient. It's either a telephone call or a video call. This particular patient has been vomiting for the past 8 months. She knows her body mass index, which is 22. Her mother saw her vomiting this morning, and the mother was worried, and therefore the mother made an appointment for you to see the patient. So you are the one who's calling the patient. This particular patient herself does not think she has got any problem. She thinks that her mother is just exaggerating things. But when you ask her, why do you normally vomit? What do you think is causing this problem? She will tell you, actually, I do it myself. Okay, why do you do it? Because I think I am fat. Yeah, so she thinks she's obese, but her BMI, if you ask her, or BMI, if you say you think you're weight, do you know what is your weight? I don't know my weight, but I know my BMI. And what is your BMI? The BMI is 22. So the patient knows the BMI. Okay, so how do you do it? How do you cause yourself to vomit? How do you cause yourself to vomit? She will tell you she uses her finger put in the throat to induce the vomiting. She does that at least once a week, and that has been going on for the past 8 months. She has got her friend at school who never puts on weight, and everybody likes her, and she's her role model because she's thin. She doesn't like going to the gym to exercise because she is put off by others who are there, who are very thin, and herself, she feels she's obese. Approach to the task. We're going to take a history. Ask about the vomiting. So you will be forced to ask about the vomiting. So do you know why your mother has asked you to make an appointment? Yes, because I've been vomiting. So you're going to start asking about the vomiting. Okay. So when did you start vomiting? It's actually 8 months ago. Okay. And how frequently do you vomit? Maybe once a week. And what do you vomit? Anything that I eat. Okay. So you're going to ask about the vomiting. You're going to find there's nothing. Anything that it makes worse, nothing. Anything that it makes do, nothing. I just vomit. When you do the eyes, what do you feel could be the cause? Have you thought of anything that could be, because you need to be vomiting? Did anything happen in the last 8 months why all this vomiting started? Okay. That's when she will tell you, I do it myself, but you must build a good rapport for her to volunteer that information. Then you're going to be asking, so why do you do it? Okay. Because you feel she's fat, so she needs to vomit, she wants to lose weight. So ask about the eating habits. Can you tell me about what you eat, maybe for your breakfast, for your lunch, for your dinner? She will tell you, I eat normal stuff. But sometimes this particular patient has got fasting. She'll eat only salads, and then maybe 1, 2, 3 days. Then afterwards, she'll overeat, and then you do binge eating, and then induce vomiting. So your history should include recurrent episode of binge eating. You can ask directly, do you binge eat at times? And when do you normally binge eat generally? And when you are binge eating, do you make sure there is no one sees you when doing it? And how often does that happen? Generally, in bulimia nervosa, that will happen at least once a week, and for a minimum of 3 months before you can make a diagnosis. This particular patient, is doing it frequently and for 8 months, therefore fulfills the criteria for a diagnosis of bulimia nervosa. Ask about recurrent inappropriate compensatory behaviors to prevent weight gain. So do you do anything to help yourself lose weight? Yes, like paging, fasting. Fasting is there because it's salad, for some days, and then followed by binge eating. Do you exercise? No, doesn't like exercise. Any particular reason? Because there are so many people who are thin and have got a good body, and I am obese. Do you use any laxatives to, help yourself lose weight? In this particular case, no. Any diuretics, any pills to lose weight? No. The only thing she does is inducing vomiting. But there's no use of laxatives or any other medication. Again, this behavior, almost at least once a week for a period of 3 months. Ask about psychological features. Yeah. Do you have a fear of gaining weight? Yes, this is why after binge eating, she has got a fear of gaining weight. Do you have mood disturbances? Maybe feeling anxious or sometimes feeling low, feeling tense. Sometimes does get anxious about her weight. Do you ever feel guilty after eating? I do feel guilty after eating. This is why she does induce vomiting. Then you have to perform, do the rest of the history, the pre-maftosa, the ICE, and the effects of symptoms. How has this affected you? Has it affected your school performance because she goes to school? How do you feel? Assess for anemia, things like any tiredness and weakness, the general symptoms of the rest of the history. Yeah. Ask about the menstrual history. Okay. Usually normal. Yeah. BMI is normal. So the menstrual history would be normal in bulimia nervosa. Unlike in anorexia nervosa, where the BMI is usually less than 17.5, and there will be history of amenorrhea. Okay. Ask about the general health, which is the pre-maftosa. Ask about the school, how she's coping, and whether, she has been affected. Her feeling that she's obese is affecting her performances at school generally. Yeah. The pre-maftosa summarize the rest of the history. Then examination. You need the oral examination because excessive vomiting, sometimes the acid may affect cause erosions, okay, of the teeth in the mouth. So in the management, you can advise that if you vomit, it's important to rinse the mouth, to wash the mouth, because the acid does not stay in the mouth, can cause damage to the teeth. Yeah, good. Measure the BMI. We can check your body mass index. I already know it, doctor. Okay, so it's already given, so you don't have to do it. You need an abdominal examination, the cardiovascular. Now, this is a telephone call. So what you can suggest is you're going to skip examinations. Then you're going to discuss the diagnosis. Is bulimia nervosa. You skip examination. Is bulimia nervosa. Then you explain it's an eating disorder where you feel that actually your weight is on the higher side, even if it is normal. A condition of eating disorder where somebody feels that their weight is higher when actually it is within normal limit. Your body mass index is 22. The normal is between 18.5 and 25. That's what is recommended. You are in within the normal body mass index, so your weight is not on the higher side. Okay. And remember, in the history, ask about her role model and what does she like about her role model. And as we discussed, she's thin, she never puts on weight, and everybody likes her. Management. Okay. So I have to explain what's bulimia nervosa. It's an eating disorder. Okay. Where you experience it or where you feel that your weight is on the higher side or that you are obese when actually you're within normal. You mentioned your body mass index is 22. The normal body mass index is between 18.5 and the 24.9. You can say up to 25. In issues. So you're within normal. Your weight is actually not on the higher side. You're actually not obese. Okay, so what you can advise, arrange a face-to-face appointment so you can see the patient and you can perform the examinations. And then you're going to refer this particular patient to child and adolescent mental health team, just to make sure that this has not affected the way you feel, the way you think generally. So we need to refer to the mental health team. We can arrange a follow-up in 2 weeks' time just to check up on the patient. We also need to make a referral for this patient to eating disorders specialist. Refer to eating disorders specialist or to pediatrician, because she's 16. The pediatrics, you're still going to fall under pediatrics. So either you can refer to the pediatrics or we're going to be referring to the eating disorder. But at the same time, we need a mental health assessment, okay, of this patient. We need to arrange a face-to-face to examine the patient. Okay, and then when we meet face-to-face, we'll examine you, we'll do some routine blood test. And then I also need to see you in about 2 weeks' time, just to check up and see how things are going until you are seen by the specialist. Again, eating disorders or pediatrician would do. Thank you.